Under eye bags are a real drag, and sometimes cosmetic fillers can make the problem worse. Well, board certified plastic surgeon Dr. Chang is live in the operating room with her patient Laura, showing us a permanent solution to this nagging problem. So, Dr. Chang, welcome to the show.
Thank you for having me, Dr. Gordon.
And here today, you're performing what we call a lower blepharoplasty on Laura, correct?
Correct.
And tell us why she is a good candidate for this procedure.
Yeah, so Laura is a 54-year-old actress who started to notice her severe lower eye bag that she felt like was hindering her self-confidence as well as her job. And so the amount of fat herniation in the lower eye is so severe that the use of filler to try to camouflage the eye bags would actually cause the midface to be really full and very large. And what that ends up doing is it makes the patient's face look very puffy. And often if you try to fill the under eye or tear trough area in this case, when the patient smiles, it actually makes the eyes look a lot smaller. So instead of actually addressing the anatomic issue, it really just camouflages the issue instead.
You've identified the problem so nicely that on the lower eyelids, as we age, most of us have a fullness below the lash, but then we have that so-called low spot or tear trough, and you want to create balance, you want to smooth it out. For those people who don't do surgery like we do, they try to fill it, and we've seen so many problems with relying on filler alone to try to smooth out that lower lid. So I'm with you all the way. Tell us, what stage are you at in your surgery that you performed so far?
So I've actually already finished the right eye here. On the left eye, I've made an internal incision in the eye so that there's no external incision. I've released the membrane that holds in those fat pads. And what contributes to the puffiness of the under eye bags is that that membrane over time relaxes, the fat pushes or protrudes out, causing the appearance of fullness, but that membrane simultaneously attaches to the orbital rim or the bone right here. So what I've done already on this left eye is I've made that internal incision, I've released that membrane, and now I'm about to dissect out the fat pads, and then I'm going to transpose it into the tear trough or into that groove to act as a filler in that space.
Tell us, while you're working, what's Laura's recovery going to look like?
Yeah, so Laura's recovery should actually be pretty smooth. This is an outpatient surgery that takes about 45 minutes or so. And afterwards, she should be going home. It's very minimal discomfort, so she should really just be okay on just Tylenol and a little bit of pain medication, but usually not. And she'll have a little bit of puffiness and swelling for the first week, but she really should be presentable after that.
I think it's so important. We're talking about lower eyelid bags. You want to go to a board certified plastic surgeon that not only can do the fillers, but has the full menu of what's best for the patient. So, Dr. Chang, we're going to let you finish up your lower eyelid surgery, and we want to see Laura's results. We'll post the pre-op and post-operative photos of Laura on our website. How's that sound?
That sounds great. Thank you so much for having me.
Well, thank you for joining us, Dr. Chang.